Welcome to the She Found Motherhood podcast. It's Dr. Alicia here, and we are lucky enough to have Celia talk to us today about her 2 birth stories, both of which were home births. She talks about the preparation that she needed to prepare her home for a safe environment, also around her informed consent discussions with her care team. She also reviews both experiences, how they were quite different, and how she actually had to get extra support from our community of care providers after the birth of her first, and found it was an experience that she was not expecting. So if you want to learn more about birth, about how to prepare for postpartum, how to care for your newborn, check out our online prenatal class. Although we do not have a section on home birth, we do cover all of the information that you need outside of that. So check it out at www.shefoundhealth.ca/courses, and you can find it there. It's a comprehensive online watch when you want, with whom you want course that goes over everything from preparing to delivery, including what Celia used, hypnobirthing, all the way through to the postpartum period with your newborn and 4th trimester. We have a huge section on how to prepare for postpartum, which Celia talks a lot about in our podcast. So can't wait to get to it right after this. Welcome to the She Found Motherhood podcast. We are Sarah and Alicia, 2 doctor moms who are creating a community rich with high quality information to support people through the journey from pregnancy to parenthood.
Our goal is to empower with knowledge and decrease the anxieties during this time in our lives. We cover topics from fertility through the 4th trimester, with the odd birth story sprinkled in.
Come join us on Instagram or Facebook at she.found.motherhood, or check us out on our website at www.shefoundhealth.ca.
Some of these podcasts have been sponsored, which allows us to continue putting out free, amazing content. But don't worry, this won't affect our advice or recommendations, and we only partner with companies we know and trust, or have come highly recommended to us by you, our listeners.
She Found Health is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information you hear does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions that you may have regarding a medical condition. The views expressed by She Found Motherhood and our guests are not representative of any institution with which we are affiliated. Hey, Celia, and welcome to the She Found Motherhood podcast. Today, you are going to share your birth story of your 2 babies with us, and I'm really excited because they're both home birth stories. And as everybody listening knows, I don't know much around the logistics of home birth, so I'm really excited to delve into that a little bit. But why don't we get started by you telling us a little bit about yourself?
Sure. Yeah. So, hi, everyone. My name is Celia, and I am actually a pharmacist. I don't know if I shared that with you, Alicia. So I'm a pharmacist. So I work in the healthcare world, and I'm a mom of 2. And yeah, I've lived all over Canada, and yeah, just that's kind of me in a nutshell.
Awesome. So why don't we kind of get into it? Why don't you tell us about kind of your pregnancy journey? So wherever you feel comfortable starting, and we'll just go from there.
Sure. Yeah. So we, thankfully, my husband and I, we didn't have any problems conceiving. So when we decided around the time we got married, let's start trying, I had a lot of fun actually tracking my basal temperature and just learning about my body in that way. It was kind of like a little science experiment. So I had a lot of fun tracking that. And we really just tried not to put too much pressure on ourselves. And both babies just took a few months. So we're really fortunate, and it worked out pretty well to conceive. So we're pretty happy, and we know that we're really lucky in that regard. And then once we were pregnant, for both of my pregnancies, I unfortunately did have quite a bit of nausea. So that's something that in the moment just feels like the worst thing in the world. Like, am I getting enough nutrients for my baby? And just trying to pick at food, trying to find the right ones. I had this horrible garlic aversion that was super annoying because I basically couldn't eat in restaurants. Not that we eat in restaurants these days very much, unfortunately, but just because everything apparently has garlic in it and it ruined everything. So that was like definitely inconvenience not like a major health issue in the grand scheme of things. It wasn't that severe, thankfully, and diclectin really helped for my second pregnancy. And then, pregnancy otherwise, I just tried to maintain as much physical activity as I could, and that really helped. I did like prenatal yoga, and so I think overall, even though in the moment I was tired and felt huge and didn't feel like myself, didn't sleep very well, I think those were all normal things, and I just tried to keep really positive with my pregnancies, and I think that attitude helped me get through.
Yeah. So focusing on kind of the good pieces of it rather than the challenges. Hey.
Yes. Yeah.
Yeah. And I think that's also really important in actually enjoying the time, because most pregnancies come with some challenges, whether that's mental or physical or medical challenges, right? And if we're able to actually focus on the positive pieces of it, then it actually allows us to enjoy this, what should be hopefully like a special time in every pregnant person's life, right? But if we kind of end up focusing on the negatives, which is so easy to do, because they're there 100%,
Yes.
then it kind of takes away from that experience a little bit. So that's awesome. And so I would love to hear a little bit about your decision to have a home birth and what that was like for you, what discussions you had with your care provider, and all of those pieces, if you're okay sharing that with us.
Yeah, totally. So I think it's really interesting about like how the people around us can inadvertently influence us. And because I never really considered home birth, I hadn't really thought too much about birth prior to trying to get pregnant. I guess, I don't know, it wasn't something that I'd always envisioned or anything like that. And I had a friend actually who had a home birth and she really inspired me to be like, wow, that's an option. I didn't know anyone that had done it. And so that's when seeing her and her positive experience, made me think, is this an option for me? So I did quite a bit of research. I got connected with a midwifery team and basically kind of started down this road of, is this even an option for me? So basically had this birth preference to have a home birth, but wanted to make sure that I didn't put my health or my baby's health at risk. And so I kind of found out that there's a certain criteria list, which you probably know about. And I know most of the criteria, I think, off the top of my head. But I just wanted to see if I met all those criteria, if this would be an option for me. And that, like, I read studies on the topic, being in healthcare, I was able to access just different actual scientific literature on the topic. And basically everything I read, the kind of summary, is that, if the pregnancy is uncomplicated and it meets specific requirements, then there doesn't appear to be, this is maybe simplifying it, but there doesn't appear to be an excess risk to the baby or the mother by choosing a planned home birth. So that was really reassuring to me, but obviously I needed to go through the pregnancy and at different intervals, make sure that I still qualified to be eligible for a home birth.
Awesome. And I'm doing a podcast, actually, recording it in a couple of days after we're recording this one, around home birth and water birth. And so we'll certainly go through kind of all the criteria and all of the reasons why, what might require you to go into hospital during that planned home birth in terms of a safety thing. And that's another really important piece of the puzzle, is having providers who are competent and able to make kind of those decisions and having the knowledge around those decisions. So all of the research out there, you're 100% right. If you're healthy and you meet the criteria for a home birth, the evidence around home births it's quite safe for mom and for baby, as long as it's done under the supervision of a qualified provider. And I think that's a really important piece that we often kind of don't think about. And in Canada, we're generally quite lucky because we've got access to that. But in other countries, such as the States, where, it's really expensive to have healthcare, or there's different trainings for midwifery, and then that can certainly be a different story. So I think that's a really important piece of the puzzle not to forget. So it sounds like, I'm going to assume, you remained healthy and qualified for a home birth. So why don't you tell us a little bit about kind of that, your first birth and kind of what that looked like?
Well, just a few other things I wanted to add to what you said is during the process of choosing my midwifery team, I learned more about midwives, and I guess I didn't know that much about midwives, and I learned that they're trained to manage medical emergencies for mothers and newborns. And so like learning more about midwives and their scope of practice and what they would be able to do to help should there be an emergency really put me at ease. My midwives were amazing, and I just really trusted them with their skills and abilities. And the other important piece that made me feel comfortable was that I live about a 15-minute drive to the hospital. And so, what I also learned after talking to midwives is like, we don't wait till it's a crisis. It's like, if there's any inkling that there's going to be a problem, you just go. And I learned that like the culture in our city of Victoria is that there's really good cooperation, collaboration. Like I'll get to it in a minute, but during my birth, I actually overheard the midwife talking to the hospital. They're like, yeah, we've got Celia here, that she's this far along. And I kind of clued into that. I was like, oh, cool. Like they're telling the hospital I'm okay and just giving them a little update. And it just was so reassuring that in our city and in our community here, that there's that really strong collaboration. And so if there was any inkling of a problem, I knew I could get the care I needed and my baby could get the care they needed right away. So that like is all about, I just don't think if anyone has any worries or fears, it's going to be a lot harder to have a happy and healthy home birth because you're going to have that fear affecting your birth. And so all of those, the research and just all the talks I had with my midwives, meeting all the criteria, like I felt happy and confident. And then my husband also had to feel happy and confident because if he was on edge, that would have impacted me too. So together we made that informed discussion. So I just wanted to comment about that as well, because there was like different layers to it, but I was really excited when I actually went into labor and I was like, oh my goodness, this is happening.
So awesome. Which is, what, and it's such an important piece, being comfortable in your care team that's providing care to you and in your environment, wherever that is, be that. And some people are not comfortable at home and want to be in the hospital, and that's wonderful, right? Yep. Or they've had a previous, issue that required a lot of support. Like my birth, I would not repeat that at home because I would not want to be at home for that, right? Even though I would have qualified, well, maybe not because of other reasons, but but because of what happened in my first birth, I would never have chosen that in my second birth because of that angst that it would happen again, right? And so, and everybody's different. And so, like you said, you hadn't considered it before hearing the story of your friend. And I think we need to all be super respectful of everybody's birth choices, as long as they've come to that with, with a good discussion and know the risks and know the benefits and have that information behind them. Then people have the ability to choose and make their own decisions, which is really important. And it's really important for us to recognize that in other people and to never judge people for whatever decisions they make, because they're coming at it from their own place, which we don't know what that looks like, right?
Totally. Yeah. And also, just to add on that, I really tried to maintain that this is my birth preference. And I think I listened to one of your podcasts about plan versus preference, because I didn't want to get like entrenched, like I'm going to have my home birth no matter what, because big picture, I want my baby to be healthy. I want to be healthy. And if there's any reason that we're at risk, screw the home birth. Let's get to the hospital. So I really tried to not get my hopes up that it would work out, because things happen, right? So
yeah, totally. Yeah. Awesome. Well, let's dig in.
Yeah. So basically with a home birth, there's a little booklet. I got a binder, the Place of Birth Handbook from my midwifery clinic, and it had like different kind of the summary of it all and a whole bunch of stuff in there. But one of the things that was helpful, because I'd already kind of, I'd read that and made my decision, was a checklist of things to have on hand. So, where you probably going to have your birth, like which room, and if it's going to be on a bed, and then mattress protector. There's one tip I saw that I didn't end up doing, but like kind of make the bed twice, so that after your birth, you can just peel off the sheet and the mattress protector, and then underneath you have another sheet and mattress protector, which would have been a good idea. But just to have the bed protected, lots of towels and washcloths. One thing that was kind of like freaky to read about it, but makes sense, was a table for infant resuscitation. So just to have physical space, like you don't want to have a bunch of clutter and then something goes awry and you need to like clear a space. Like everything needed to be kind of as much as possible planned ahead of time. And then if you plan for it, it's less scary because it's like, okay, we're good, which we never needed to use, thankfully. But so a little table, then they said, can you have a bag or a container for the placenta? And because you got to think of all these little details. And our midwife, one of our midwives actually came to our home before the due date and kind of did an assessment, like just making sure that we had kind of gone through the checklist and it was a safe environment, and just literally where we live. Like we kind of live on a small street tucked away, and just, okay, how do we get to your house? That's helpful to know. So that was all good, just to kind of make sure we're all on the same page. And then that was kind of the preparation. Anything else about preparation, or should I just go into the birth?
No, that's great. And then the midwives also they've got kind of home birth kits that they bring with them, with all the kind of emergency supplies that they need, and any kind of the regular stuff. But for any kind of those complications that are, may arise, they kind of bring the supplies that they need to manage those as best they can in the home environment. So, yeah.
I actually they'd given me ahead of time a few medications that were refrigerated. And so I had those in my fridge so that if they needed to come more urgently and didn't have time to pick it up at the clinic or whatever, I just had it on hand. That was nice. Didn't have to use them, just gave them back to them, but it was just stayed in my fridge kind of thing. So I went into labor for my first birth on my due date while we were out for a walk. Thankfully, we weren't too far from home. I was like, I think this is happening on my due date. What are the chances? I was kind of in denial that no one actually has their baby on their due date. This is crazy, but I was going into labor. We got home. I tried to nap. I had a really good relaxation meditation that I had learned about through a hypnobirthing course that I did. And I loved listening to that leading up to my birth. And so when I went to labor, I put that on. We'd actually got a birthing pool, which I wasn't planning a water birth, but I'm very tall and I don't fit very well into our bathtub. So I thought, hey, this would be a good thing just for comfort to have a big tub in our living room. So we set it up. We didn't fill it up. We just set it up. And then, we just kind of like hung out, and we started making my favorite soup. And then things started to ramp up quite quickly. So this was just like after a couple hours or a few hours. So we called the doula, we paged the midwife. Things were starting to get a bit more intense. And the midwife suggested hydrotherapy. So my husband started filling the tub. But then as things got more intense, we were kind of doing some positions and we lost track of time. And the tub started to fill up with cold water because our hot water tank isn't very big. So that was a total bust. I feel it's like funny in hindsight, because by the time I like stepped into it, it was like lukewarm at best. And so we had this huge tub in our living room, and I'd like set up these lights. Like I was so pumped to like be in there, but it was this wasted space because it was, I couldn't even use it. But anyway, so if you are thinking of having a home birth, and if you are thinking of getting a tub, maybe check the capacity of your hot water heater, or if you have unlimited hot water, that would be awesome. The doula showed up. Renee's just so awesome. And I was kind of feeling like disappointed about the tub, but she was able to like get me into a groove with breathing and positions, and just kind of moved on from that. I labored on the toilet. So like just nice to be in my own space, my own bathroom. And things were pretty intense. The midwife came and checked me and told me I was 3 centimeters. And I distinctly remember being very disappointed. I heard like, it's my first birth. You just don't know what it's going to be like. And it was very intense. I say intense because just going back to hypnobirthing, I really liked the language they used. Like instead of contractions, they used surge, and instead of pain, you used like sensation or intensity. So it was painful, but I try to not use those words just because I find that they were a bit more negative. So anyway, so things were very intense. And I remember feeling a lot of doubt in that moment when she told me I was 3 centimeters, because I was like, how am I going to get to 10 centimeters? Like, I'm going to need to go to the hospital. I'm going to need an epidural. Like, I can't do this. And I just was flooded with all these doubts about the home birth. But then I don't know how, but Renee, our doula, just like, it's like, okay, let's move. Let's get into a new position. Let's try something else. Let's do some breathing. And with her and my husband and the midwife, like, I was able to kind of push away that negativity. I didn't say those doubts out loud because I think my husband and I think he would have sensed, or like if I had said it, he would have also started doubting things too. So I was able to kind of keep it inside, and then with the help of my team, move forward. So that was really powerful to kind of get out of that negative space. And then, so what happened next? Then actually the midwife left. So that also was a huge, like, all this happening at the same time, because I was like, oh my goodness, like, now she's gone. How are we going to know to call her back? Things are so intense already. So that was a little bit scary, because I was like, how are we going to know when to call her back when things are already so crazy, in my opinion? But having the doula there, who's like experienced in birth, she's not a healthcare professional, obviously, but experienced. And I don't know, like, it just kind of like, we just kept moving forward. And eventually, like, Tim was trying to like boil water, my husband, to get like the tub to heat up again. But basically the hot water tank refilled, and I had a shower. And that shower was amazing. And this was probably like 2 hours later. And Renee was like, I think that shower really helped things. Like, Tim, you should page the midwife again. And the midwife came back, and this was, like 2 or 3 hours later, and I was fully dilated. And so within like 2-3 hours, I went from 3 centimeters to 10. And so
that must have been incredibly intense for you.
It was.
That must have been a roller coaster. That's crazy, hey, for a first time. I mean, from what you've said, you're quite tall, and I find people who are taller. Anyways, but I mean, that's not unexpected for our second deliveries, but from our first delivery, that is expeditious.
Yes. So that ties into my second birth. So we'll talk about that in a minute. But yeah.
I did a water slide motion in case.
Yes. Yeah.
Woo, water slide out. Okay. I'm envisioning the second birth story in my head already. Okay. So now you're fully dilated.
Fully dilated. Midwife is back. Second midwife shows up. Midwifery student came too. So I felt so supported.
Let's pause there. The second midwife is there because we want one care provider for mom, and or for the pregnant birthing person, and we want one care provider for the baby. Yeah. So we need one person for each of those people. So that's why any home births always have a backup midwife who will come in to kind of help support in case either mom or baby gets into a pickle, and we need to kind of have extra support around that, but also making sure that the other one is fine too.
Yeah. So I felt so supported. There was also a midwifery student who I'd consented to ahead of time that, like, if there was one, they could come, kind of thing. And she was graduating like next week or something. So I basically had 3 midwives, and they were all amazing. And we were in the pushing phase. I was feeling obviously tired and depleted. I'd kind of emptied my bowels and vomited. So I was feeling pretty low on energy at that point. But I remember at one point that I had cut up a cantaloupe earlier that day randomly. And I remember the midwife like feeding me a piece of cantaloupe. Like, it was intense, but it was also a lot of fun. Anyway, so it was just a really great environment. I did start to really slow down. Like, I don't know if it was psychological or physiological, whatever, things started to slow down. And my surges started spreading out a bit. And so I don't know if that was, anyway, hard to say, but we actually tried nipple stimulation, and that really helped move things along. Also, I felt like I had like a cheerleading team. I remember them specifically like, okay, Celia, long and strong. And like, I felt really supported. And things were kind of, I think, progressing. But at one point, they were checking on the baby's heart rate. They were just kind of checking if, because I think by this time it had been just over 2 hours. And they were just making sure that the baby was still doing okay. So they're frequently checking the heart rate. And then at one point, when the midwives said, we might have to do an episiotomy. And I had learned about episiotomies previously, and I knew I didn't want one unless I obviously really had to. And I remember I was very quiet. I didn't really say much, but I just looked at my husband, and he knew exactly what I was thinking. He's like, she doesn't want that. And they're like, well, let's just see if we can get this. And that was the motivation I guess I needed, because a few pushes later, we had our baby, and it was a girl, and it was really fun. My husband told me the sex. So that was really special. And yeah, it was just like really amazing to be in our home in that moment, and surrounded by this team, which you would be surrounded by a helpful team at the hospital too. But yeah, it was just really an amazing moment. And then delivering the placenta was actually pretty challenging for me. I did get a postpartum dose of oxytocin, but basically, like, I had to like get up on my hands and knees, or up on my knees, and I was like really had to push. Eventually it came, but it was definitely a bit more challenging. And then breastfeeding, like the baby latched well, and so it was just kind of like, I guess I don't have a frame of reference about what happens in the hospital, but like it all seemed like everything, like I did have a tear, and so like the midwife stitched me up. It was relatively mild. I think it was 2nd degree. They like measured the baby in like a cloth scale. So it was all kind of, I think, the usual stuff that you would do postpartum. It just happened to be in our house. Yeah.
Yeah, for sure. No, it sounds like, and kind of skin to skin right away and all that
Yes.
good
Yeah.
stuff. Hey, and
Yeah.
did your hubby cut the cord, or how did
Yeah.
you guys? Yeah, awesome, fun,
Yeah.
fun, cool. Yeah, that sounds like a wonderful, like, quick labor, but your pushing was a couple hours. Hey, sounds
Yeah.
like.
And the
Yeah.
midwife,
Which-
like it was just over 2 hours and something like that. But at one point I remember the midwife's like, I'm going to go grab my birth stool. And I felt like I was like in the Ina May Gaskin book or something, because she like ran out to her car and like brought it in, and that really helped. I'd never heard of a birth stool before, but that helped. And
Awesome.
so
Yeah. Yeah. Oh, it sounds like a wonderful birth. Hey, and full of wonderful memories too, right? Which is, again, very important.
Yeah.
So tell us about kind of your postpartum experience.
Well, one thing I just wanted to mention about home birth, because a lot of people say, oh, it must be so messy. Like, what do you do with the blood or whatever? But like I said, so we had the mattress protector and sheets and towels galore. And we do have one of the rooms I was in, like, I broke my water on the bed actually. And so just kind of like quickly changing things up. Like it seemed like you kind of have to be prepared with extras of everything, but it was pretty straightforward. And our doula Renee was amazing. She like helped like strip things down. She like went and put them in the washing machine for us. So that was really, we're fortunate that we have laundry in our home. So it was pretty straightforward. I don't know, a lot of people wonder about that too, but it wasn't really a big issue for us.
I think I said this to you before, I envision like this big tarp being laid out, and you birth on the tarp, and then just like take the corners of the tarp and tie them up and throw them in the garbage after burying the placenta behind in the tree.
No,
under the potential tree, which I think is a great idea.
Yeah.
Plant a tree over your placenta to commemorate your amazing birth.
Yeah.
Wonderful.
Yeah. No,
No tarp needed though. Hey,
no tarp needed. No.
Well, there you
A lot
go. You learn
lots of
something new every
laundry.
day.
Lots of
Lots of
laundry.
laundry. And a bigger hot water tank again.
Yes, yeah, yeah.
Awesome. So,
Um,
so tell us, okay, how did things go after that? Thank you for that segue because I forgot to ask and I was
yeah.
curious.
um, well, one kind of weird moment was after like it was several hours that the midwives were there and the doula was there, but when they left, it was kind of like, oh wow, we're all by ourselves with our new baby. Oh my goodness. And I think that would be definitely a difference with the hospital is like having the nursing support and I don't know, it was a little bit surreal when everyone left and we were just like all by ourselves with our new baby in our house. But it was also wonderful. So that was really nice. Postpartum, the midwives do, I can't remember the exact rule of thumb, but they do daily home visits, and then kind of determine the interval based on how you're doing. Breastfeeding, like I think universally, of course, it's hard and exhausting. And I joke that my two favorite feelings that I've ever had in the world was one, when I push the baby out, like when the baby actually comes out and you know that they're through. And the second is when your milk comes in and you hear the glug of your baby, like the most satisfying feeling. Because when your baby's trying to work with you to get your milk to come in and you're just like, you know, they're hungry and you want to give them milk and you're just like, come on, body. And just so tired after trying to do that every few hours or whatever. So we managed to get through that and my milk came in and the tears came and but the first few days were very positive just being at home. Um, Unfortunately, though, on day 5, I woke up again in the middle of the night to feed our daughter, and I was shivering like crazy. And I was like, "Oh, that's weird. I must just be so exhausted. I can't maintain my heat." So I like got some quilts. But then a couple hours later, I woke up again, and I was boiling hot, like roasting. And I was like, "This does not feel good. This is a problem." So I checked my temperature and I did have a fever. And that was a pretty scary moment. But this was probably like around 6 a.m. or something. And I paged the midwife and she was amazing. She came over right away and she assessed me and advised me that I should go to emergency because it seemed like I had some sort of infection. She spoke to an obstetrician over the phone at the hospital. And I was so appreciative of that, like I was saying earlier, that collaboration, because this was in February, like flu season, going to emergency with a 5-day-old baby. I was like, this is so terrifying. But, you know, with that communication, I got streamlined to go into like a area of emergency that was kind of tucked away from everyone else. And got to see the emerge doc, obviously, and the OB. And I ended up having an infection called endometritis. And the OB, the theory was that had something to do with the difficulty delivering the placenta, perhaps, or we don't really even know why, but they just reassured me that unfortunately this can happen sometimes after birth, and got some IV antibiotics and I recovered. And then, yeah, that was
Yeah.
basically it. That was a bit scary to end up at the hospital after this amazing home birth. But it was just a little blip in the overall story, and got home and I had a few days of oral antibiotics. But basically, I was just so grateful for modern medicine because, yeah. And then, yeah, just kind of after that, just got back into the 4th trimester groove, just back at home, cozy with baby and my husband. So, yeah.
Awesome. Yeah, and you're right. It happens. Endometritis is essentially an infection of the lining of the uterus, which it happens not, I mean, not super frequently, but not infrequently. And we have so much bacteria just in our vagina naturally, that every once in a while that bacteria can go up and cause an infection in our uterus. And so those are usually, fevers or chills or increased discharge or foul smelling discharge or increased bleeding when things seem to have been settling quite nicely. So, but yeah, it can happen regardless of place of delivery, mode of delivery. And so it's just one of those things that we have to be aware of and keep an eye out for. But yeah, luckily we are able to, and you being a pharmacist would appreciate,
Yeah.
go in and treat it. Because back in the olden
Yes.
days, that was a
Yep.
huge reason for kind of mortality and death
Yeah.
around delivery is kind of infections that we can't manage. So
Yeah.
we are very lucky.
Very lucky to live in this day and age. Yeah.
Yeah. So I'm excited to hear about your second birth.
Okay. Yeah.
Woo-wee, sounds fun.
Yeah. So second birth, I think the midwives, I went back to the same team, of course, because they were amazing. And they're like, so based on the fact that you went from 3 to 10 centimeters in 3 hours or whatever it was, like, they were like, yeah, if you're eligible for a home birth again, like, is that something you're interested in? And absolutely. So that was kind of the plan. But then I had a low-lying placenta. And so the risk of postpartum hemorrhage was deemed to be potentially higher. So I was referred for consultation with an obstetrician, and they basically just kept an eye on my placenta and just its location relative to my cervix. And after, I can't remember, I had a few ultrasounds to kind of keep an eye on things, and it moved. So for a while I was kind of like, okay, I'll have hospital birth, that's fine. But then when it moved and I was cleared to have a home birth, I was happy to proceed with that plan.
That was the reason I couldn't have had a home birth in my second, was a low-lying placenta as well.
Yes. Yeah. So yeah, it was good to kind of, again, just follow the advice of the experts. And yeah, so I was happy when it did move, but yeah. And then, so for this birth, I went a few days overdue, and I went into labor around 4 o'clock in the morning, and I was at home in bed, and things were pretty mild. So I just laid there, tried to get a bit more rest. I didn't wake up my husband because, you never know if it's going to be like a marathon or whatever. So get a bit more rest. And then our toddler woke up at 6 a.m. as they do. And it was actually a really fun morning. We had a pancake breakfast, and things were pretty chill. So it was not ramping up right away. And then luckily my parents were in our bubble at that point. And because my daughter had been out of daycare, this is just last September. So we're in COVID time. And so my parents came and picked up our daughter. And it was after she left that I was actually able to, this is probably like 8:30 or something. And I started to actually think so in the middle, at 4 a.m. when I had my contractions, the baby had seemed very active. And I all of a sudden started worrying for some reason that maybe the baby had flipped and gone to breech. And I couldn't get it out of my head. I was like, what are the chances? It's probably just kicks, but I just couldn't get it out of my head. And I was like, again, I don't want to risk putting my baby or myself at risk unnecessarily, obviously. And so I paged the midwife, even though things still seemed very early. And apparently mid-September is a very busy time, or that day happened to be a very busy time to have babies. And she was at a birth at the hospital. The other midwife was at a birth. The other midwife had just fallen asleep from a birth. And she was like, can you just come into the hospital and I'll check the baby's positioning? I'm like, yep, no problem. So we kind of were like, okay, well, what if, let's grab the hospital bag. We went to the hospital, kind of what's going to happen next kind of thing. And went in there. The midwife checked, baby was head down. It was totally in my head. But anyway, it's better to check than not.
Better to be safe. I always say that to pregnant people. If you are worried, get checked out.
Yes.
Because you will never regret getting checked out, but
No.
you will always regret not getting checked out if something's going on, right?
Exactly. Yeah. So it's definitely by far the right decision. Again, 3 centimeters. And things were pretty chill. And so I was like, so I asked the midwife, so should we stay? She's like, we chatted about it and basically decided it's very reasonable for me to go home. Things were pretty quiet in terms of my surges and how I was feeling. So we drove home, but on the drive home, things started to feel more intense. And I had, I think, 3 surges in the span of 15 minutes. They were pretty close together, but I was like, maybe it's because we're in the car. And I was kind of scrunched, in a car, not scrunched, but, in a car versus standing, it's not as comfortable. And got back home and I just decided to phone the doula. And I was like, can you come? I don't know. It seems like things are kind of ramping up a little bit. And so chatted with her, she was going to come, went inside. Soup is my go-to in labor. Like I love brothy soup. So like I had some soup. I was like sitting having some brothy soup. And all of a sudden, this is like 20 minutes later or something, I was like, I need to have a bowel movement, like pretty intense. So went to the washroom, emptied my bowels. At that moment, the Renee showed up. So I came out and I was like, oh, I still have a lot of pressure. And I was kind of like leaning on the counter in the kitchen, like leaning over, and my water broke. And all of a sudden I was like, I need to push right now. And I didn't want to, but I was like, oh my goodness, the baby's coming. And then Tim was like calling, like paging the midwife. Renee was like, puff, 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 like trying to get me to do like breathing to slow things down and try to like bring down the intensity. And then, so luckily the midwife called back right away. She could hear in the background that I was like, oh my God, baby's coming. And then Renee got me over to the bed and like got me with my butt up in the air, like kind of, she called it the break position. It was kind of like downward dog. And I could barely do it because I felt so much pressure in my bum, but she was like basically holding my butt in the air. And I was like, I need to push. And she's like, puff, puff. Like Renee is amazing. Just such a rock, just like trying to get me like the adrenaline, come down, let's breathe and get me in the right position. Tim was on the phone with the midwife. Like, she was like, okay, someone is coming right away. Like she was at a birth. So it went from like 0 to 100 in a few minutes. And yeah, basically Tim was staring out the window, like just praying for this midwife to show up. And Renee was helping with breathing. And then Renee told us after that she was basically about to say, we need to call 911 because like she's not a healthcare professional. She was like, this baby could come and we need to have someone here. And she didn't know when the midwife was going to come, right? It could be 5 minutes. It could be an hour. And so, but luckily right before she said that, the midwife pulled up, like luckily she'd been close by. Tim like over here, like trying to like wave her in. And midwife, like, apparently I didn't see her, but like grabbed her supplies from her car, had her mask on, ran in, gloves on, like got all, and then flipped me over, looked, and she's like, you can start pushing. So again, I got
the baby's hair.
Yeah. So I went again from 3 to 10 centimeters, like in an hour or something like that, like so fast. And the other thing I wanted to mention, I remember like, it was scary in that moment before the midwife came, but I remember actually talking to the baby. I was like, baby, we're not ready. Baby, wait, baby. Like, we need the midwife. You have to wait. And I like, it was a weird kind of moaning, like very primal. Like I was like channeling this connection to the baby. Who knows if that's true or not, but the baby waited. So
smart baby.
Yeah. And yeah, basically the midwife said when she said I could start pushing, about 10, 15 minutes later, the baby arrived. So it was very whirlwind. And, when we were debriefing, it's like, maybe we should have stayed at the hospital. But it all happened so fast and it all worked out. There was only one midwife there when she was born, but the second midwife showed up shortly thereafter. And we had another girl, and she was a little bit on the, like, her temperature was a little bit low and she was crying, but not too much. So like skin on skin. And I was like trying to rub her back, and I still needed to deliver the placenta. Like it was pretty chaotic in those, like, just, it felt chaotic just because like all of a sudden the baby was here like so fast. But Alice, our daughter, she was fine. And she, like, her temperature came up and she was louder with her cries and everything was all good. They said that maybe it was because she was stunned from like how fast the birth was. And so, yeah, it was all good, but it was like a pretty crazy moment. And my husband was like, maybe we should have just had a hospital birth, but like hindsight is 2020. And I'm still so happy how it turned out, but it was definitely much more intense. Like the first birth was like this big team around us cheerleading. And then the second was like, puff, 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 puff. Okay, the baby's here. So I'm actually glad it was a planned home birth after I've given it lots of thought, because if it hadn't been a planned home birth, it might have been an unplanned home birth. And like we were prepared for a home birth. It was just because it happened so fast. That's what just made it more intense. But it was as safe as it could be, I think. I think I'd rather have given birth like I did than in the car on the way to the hospital kind of thing. So
Yeah, for sure. With Tim delivering your baby. I was going to say, did Tim take a birthing course before?
Yeah.
But it's true, right? Those second babies, they often come much quicker than the first. And it's not anything we can prepare people for. We tell them all the time. But it's just such a different experience. And it's such an intense experience. Each birth is an intense experience because you can't be prepared for the first one, and you can't be prepared for the second one. Maybe the third one, you now know what you're getting into because you've had kind of a bit of a longer one but even those ones, they can turn out differently. So it's each birth is its own experience, and it comes with its own, things, right? So awesome. So if you were to, you've kind of said what your favorite thing is, but I'll ask you again, what was your favorite moment from your experiences? It could be one from each of your girls or just in general.
Favorite moment. Well, I think like the moment for both of them when we were skin on skin, like feeling the baby, like I've had this baby inside me for the last 9 months, and then feeling them on me and hearing their cries. Like, I just don't think anything can beat that. It was just really like emotional to have that moment. And that could be at home or in the hospital. Like it was just that connection was really wonderful. Having my partner by my side too, my husband, was just really amazing.
And what was one of the more challenging things for you? Like what if your best friend was to say, you know what, like what was one of your challenges? What can I prepare for? Like what happened that you weren't expecting?
For the birth or postpartum or either?
Anything.
I think just really being aware of how challenging that first week can be with feeding. And I feel like the second time, knowing what I learned from the first birth about like waking up every few hours to feed the baby, and like before your milk comes in, or if you do have troubles with breastfeeding or whatever, like that is exhausting. But knowing that and knowing you can get through it with support, obviously don't try to do it on your own if you're really struggling. But I think mentally knowing that it is hard, and reaching out for support, trying to like have a moment for self-care, like trying to, because that first week I think is exhausting. And for the first time around, my husband only took 1 week off work, but he was able to take 2 weeks off the second time around. And just having him around for more support longer made a big difference for us. So we were fortunate that he was able to do that with his work. But just kind of mentally preparing that it's hard and it's going to get better. And I don't know, I feel like in the moment when you're just so sleep deprived, it's really challenging. But then if you can kind of look forward and be like, it's going to get better. I need to do this now, but it will get better. I don't know. I think that helped me a lot the second time around.
I remember my sister-in-law, she had 2 children before I had my first. She said to me, it's going to be hard, but each week gets easier.
Yeah, totally.
Each week gets easier. Just remember that. And it's true. So true, right? Yeah. Thank you for sharing your story with us.
Thanks for listening. Sorry, it's quite a whirlwind. Yeah, but I really appreciate it.
Yeah, well, your delivery was, for sure. Such wonderful stories. And when you said kind of we have an amazing team in Victoria and we collaborate well, it is so true. And you and I were talking about that before, like midwifery, family practice, doulas, obstetricians, anesthesia, pediatrics, like everybody who needs to be involved in kind of that journey from pregnancy to parenthood. In Victoria, we have such an amazing team. We all work so well together. We all are very supportive of each other. And I always feel so blessed to be working here within that group of people. And you really can't go wrong with any care provider you choose, because everybody is, we have the same that same outlook in terms of, caring for pregnant people, caring for the babies, and working as a team to do that with our patients or clients as the obviously the main part of that team. So I really am happy that you got to, unfortunate for you that you got to experience it, but also happy that you were able to kind of reflect on that and recognize that, because it's a very important part of how we can safely support people and their choices in our community. So
I totally agree. I'm so grateful for that.
awesome. Well, thank you so much. And your lovely baby napped so well this entire
Yes.
time. Success.
Yeah.
Awesome.
Thank you so much for having me.
Have a great day, Celia.
Thank you.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood, and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.